And I would like to request Ratna ma'am to be on the stage.
Dr. Gautam Sadhu sir, may I please kindly request you to address the gathering.
So, good afternoon to all of you. I'm sure you have a good food, and after good food, there's a good discussion also. Okay, and this is track 2, and track 2 is a very important theme we are going to discuss, that is on AI for sustainability development, CSR, and ESG performance management. And it's a very important discussion, and it's given me immense pleasure to welcome you to this important session. And we are meeting at a defining moment in history when artificial intelligence is no longer just a technology tool, but a strategic enabler of sustainable transfer. Across sector, organizations are increasingly expected to demonstrate measurable social impact, environmental responsibility, and strong governance. In this evolving landscape, AI is transforming how institutional design, implement, and evaluate their CSR and ESG commitment. By integrating large and complete data set, AI enabler transparent, real-time impact assessment, predictive forecasting, intelligence benchmarking, and automated reporting. These capabilities significantly enhance accountability, reduce information and support information gap, and support evidence-based decision making. However, while technology is strengthening efficiency and precision, it is also compelled us to reflect on ethics, inclusivity, stakeholder voices. One side, the technology is there, and one other side, the stakeholder voices is also important. And sustainability development is ultimately about people, about community, equity, and responsibility toward the future generation, that is sustainability. Therefore, the integration of AI and CSR and ESG framework must remain human-centered, participatory, and ethical grounded. We are truly privileged to have an eminent panel of speakers who bring diverse and practical perspective to this theme, and I welcome on behalf of the IIHMR and the student community to all of you. We have Mr. Tarachand, who is head CSR Oak North, who will share insight on AI and CSR for sustainable development, highlighting how corporate strategy can align innovation with responsible growth. Then our next speaker will be Dr. Chetna. Dr. Chetna, she is technical lead health at ACL Foundation, and who will speak on integrating AI into achieving CSR and SDG health, drawing upon her field experience, because as we know, the ACL is doing a lot of field works, field activities, and they've involved the NGOs and the development partners also. So seeing the rich experience, we will listen Dr. Chetna also. Dr. Sijan Kishore. Dr. Sijan is manager at Humana People to People India, and his PhD is also on the CSR and the ESG management. So his expertise will offer a critical and timely perspective on keeping human in the loop, because that should not be neglected. AI, ESG, and the risk of losing stakeholder voices, reminding us that technology efficiency must not overshadow the community participation, community engagement, and social accountability. Then we have a very prominent speaker, Dr. Nipa Saha Sharma. You're welcome, ma'am. General Manager and Head CSR, CESC Limited, and who will deliberate on the convergence of technology innovation, corporate responsibility, and regulatory requirement, especially in the era of increasing ESG disclosure and compliance expectation. I'm sure today's discussion promises to be intellectual, stimulating, and practically relevant as to explain how AI can enhance CSR performance measurement and ESG governance. Let us also reflect on how technology can serve as a bridge connecting innovation with integrity, efficiency with empathy, and growth with sustainability, of course, involving the community. I warmly welcome each one of you, and also Dr. Ratna Verma, who is our colleague, faculty colleague, and look forward to a rich exchange of ideas that will help shape responsibility, data-driven, and inclusive pathway towards sustainable development. Though due to the paucity of the time, I would request the panelists to, I know you have a very rich experience, and it's very hard to sum up the thing within 8 minutes. So within 8 minutes, I would request to complete it. First, I would request Mr. Tarachand, Head CSR, to selfie. Please, sir. Good clap for him.
Thank you, sir. Good afternoon, everyone. I would like to thank IIHMR for inviting me to this conference and share my thoughts and interact with you and learn from my fellow panelists. And I would like to congratulate them for organizing such a nice discussion we had in the morning. It is really enlightening to learn from the practitioners who are bringing a lot of information in the field of health. I am not a health professional, and mostly CSR professionals are jack of all trades, master of none. So today the topic allocated to me is how to measure the performance. What is the importance of measuring the performance of ESG, sustainability, and CSR. So when we talk about measuring CSR, ESG, and sustainability performance today, we are no longer talking about reporting formats or compliance checklist. We are talking about accountability, we are talking about risk management, we are talking about long-term enterprise value. And increasingly, we are talking about data. The convergence of performance measurement and artificial intelligence is not a futuristic conversation. It is already reshaping how organizations understand impact, manage risk, and create long-term value. For many years, CSR evolved from philanthropy to compliance, and from compliance to strategy. ESG evolved from voluntary disclosures to structured reporting. Sustainability moved from peripheral conversations to a boardroom priority. But today, we stand at another turning point, where CSR and ESG must now evolve from strategy to performance intelligence, because the complexity of the challenges we face today, like climate volatility, supply chain fragility, learning poverty, health inequities, and water stress, lot of other problems we face today. These cannot be addressed with intention alone. They require measurable outcomes, they require predictive capability, they require integrated thinking. And this is precisely where AI becomes a powerful enabler. Let us reflect honestly on how CSR and sustainability have traditionally been measured. We have counted inputs and outputs. How much money was spent, how many beneficiaries were covered, how many classrooms were built, how many trees were planted, how many workshops were conducted. But these metrics are easy to compile. They fit neatly into sustainability reports. They fit well into board presentations, but responsible growth demands deeper questions. Are those classrooms improving learning outcomes, learning levels? Are those trees surviving beyond first monsoon season? Has household income increased sustainably or for a longer term? Has emissions intensity reduced relative to revenue growth? Are water conservation projects reducing long-term operational risk? Performance measurement requires us to move from activity to outcomes, and from outcomes to durability. Performance measurement, use of AI in performance measurement allow us to make that shift with greater precision. Consider project selection. What we basically consider, our focus is largely on, when we select a project or allocate capital, we focus on, proposal driven. Our decisions are proposal driven. We assess budgets, we assess concept notes, geographic coverage, and partner credibility, the credibility of NGO. But imagine if we could have analyzed historical performance data from thousands of interventions across sectors and regions. AI systems can identify patterns which skilling programs consistently correlate with sustained employment. Interventions produce measurable gains in foundational literacy instead of relying solely on persuasive narratives. Companies can use evidence-backed insights to allocate capital where durable impact is most likely. This transforms CSR from reactive funding to intelligent social investment. Now think about monitoring and governance. One of the persistent challenges in CSR and ESG oversight is delayed visibility. We often discover gaps during annual reviews or quarterly reviews or third-party evaluations, long after funds have been deployed or used, targets missed. AI-enabled systems can analyze real-time streams across projects and operations. Satellite imagery can monitor vegetation cover and land use change. Sensor-based data can track energy efficiency or water consumption. Pattern recognition models can flag anomalies in financial utilization or procurement practices. If attendance if in a school, is monitored, how that has declined or, improved sharply. If a livelihood program underperforms relative to seasonal benchmarks, or if emission levels spike unexpectedly. Early warning systems can alert decision makers. This is not about replacing human oversight, it is about strengthening it with timely intelligence. The third dimension is ESG. Alignment. In the morning, sir was talking about society, that sustainability covers social, environmental. When we talk about companies are, can survive only when they focus on environment, social, and governance parameters. So the third dimension is ESG alignment and long-term enterprise resilience. CSR today does not operate in isolation. Investors, regulators, board increasingly ask how sustainability performance reduces enterprise risk and enhances long-term competitiveness. With structured ESG disclosures becoming more rigorous, companies must demonstrate credible linkages between environmental stewardship, social investments, and government practices. AI can integrate data sets across functions, CSR initiatives, environmental metrics, demographic data, supply chain indicators, and financial performance. It can help us assess whether climate adaptation projects align with high-risk geographies. It can evaluate whether skilling investments correspond to emerging labor market demand. It can improve us beyond cost per beneficiary to cost per sustained outcome. That it is fundamental shift in how value is defined. Let us consider specific sectors. In education, AI-driven learning analytics can identify students at risk of dropout and tailored remedial pathways. Instead of reporting the number of digital classrooms installed, organizations can measure improvements in reading proficiency and numeracy outcomes over time. In healthcare, predictive models can identify malnutrition, hotspots, or disease outbreak patterns, enabling targeted interventions instead of counting health camps. We can measure reduction of incidences and sustained nutritional improvement. In climate and environment projects, satellite-based AI tools can track forest cover changes, verify tree survival rates, and estimate carbon sequestration with far greater accuracy, and then periodic manual surveys. Instead of reporting trees planted, we can report carbon captured and ecosystem restored. The shift is profound. We move from symbolic metrics to durable results. However, we must acknowledge a critical truth. AI is not a solution in itself. It is an amplifier. And like any amplifier, it magnifies both strengths and weaknesses. Poor data quality can produce misleading insights. Algorithm bias can unintentionally exclude vulnerable populations. Over-reliance on quantitative dashboards can obscure qualitative realities, the lived experiences of communities. The data privacy concerns are especially sensitive in health and education contexts. Therefore, ethical governance must anchor AI-enabled performance measurement, transparent methodologies, strong data protection systems, informed consent, bias audits, and continuous human oversight are essential. Technology must enhance judgment, not replace it. If implemented responsibly, AI can democratize impact intelligence. Smaller nonprofits can access analytics tools that were once available to larger organizations. Boards can review dynamic dashboard instead of static summaries. Continuous learning can replace annual compliance rituals. Decision making can shift from personality driven to evidence driven. So what should organizations do? First, build data discipline, standardize outcome indicators so performance can be compared across projects and time periods. Second, create integrated data systems that fragmented spreadsheets, then fragmented spreadsheet data architecture is foundational to intelligence. Third, pilot AI solutions in clearly defined areas, monitoring compliance gaps, forecasting environmental risk, optimizing resource allocation. Fourth, build capacity. Sustainability professionals need not become data scientists, but they must understand how algorithms interpret data and where their limitations lie. And finally, establish ethical guardrails before scaling technology. Trust is built not only through performance, but through responsible use of data. The future of CSR and sustainability will not be defined by how much is spent, but by how intelligently resources are deployed. The question before us is not whether AI will influence sustainability performance, but it is already influencing. The real question is whether we will use it to deepen accountability, strengthen resilience, and create measurable, lasting change. The sustainable development remains fundamentally about people and planet. AI can process vast data sets, detect patterns, and forecast scenarios. But empathy, contextual understanding, and ethical responsibility remain human commitments. When we combine disciplined performance measurement with the technological intelligence, CSR and ESG move beyond compliance into strategic instrument to inclusive and resilient growth. If we get this right, AI will not replace the human purpose of sustainability, but it will sharpen it. Thank you. Thanks.
Thank you, sir, for your enlightening and thought-provoking insights.
Our next speaker for the afternoon is Dr. Chetna Tirathali ma'am, a public health specialist and medical doctor with over 13 years of experience in community medicine, program leadership, and academic teaching. She currently serves as business lead, health at HCL Foundation, leading strategic CSR health programs reaching over 350,000 beneficiaries across urban slums in cities including Noida, Bangalore, and Chennai.
Ma'am, it's an honor to have you with us today. We request you to kindly take the stage and address the gathering.
Good afternoon, everyone. Hope you're not sleeping post-lunch. Can you show me the slide? Okay, so those students who are here know CSR, right? Corporate social responsibility, so much is being spoken about it, okay? So I come from HCL Foundation, the CSR arm of HCL Tech, and we do a lot of work in the community in relation to the CSR norms that we have in our country. HCL Foundation's vision is to be the source code for sustainable socio-economic and environmental development. And our mission is to nurture clean, green, and healthy communities, okay? And HCL Foundation works across the 17 sustainable development goals that we have. This one. So just to give you an overview, we are present across 20 states, 3 union territories, and 103 districts of India doing the CSR work. We are not just restricting ourselves to people, but also we work on the area of domain of planet and environment. 7.5 million lives is what we have impacted. We also work for the people with disabilities, supporting them, and also trying to get people the social security schemes that so many people speak about but do not have an access to. So this is our strategic program framework. We have rural programs like Samuday HCL Tech Grant, Uday, urban programs, which is Uday and My Clean City, environmental program, which is Harit, and we have some special initiatives like Sports for Change, Power of One, My eHeart Academy, and we have a focus on early childhood care and development, education, health, WASH, skill development and livelihood, environment, disaster, and gender. So Uday's main agenda is to break the cycle of urban poverty. From morning you're hearing about it. Health has various determinants. It's not just the health, but also the background, the situation of those people, the education level of those people, which is a determinant to decide whether they will get a proper treatment, whether they have the required knowledge or not. So we work across these key strands to merge seamlessly and increase access to entitlements. This is, please, go back. Go back. Yeah. So sorry, I'm feeling like an illiterate now. Thank you. So what we realize is India is a country, it's not just one country, it has multiple states with its own set of problems. And the epidemiological shift that is happening, it has resulted in us facing both communicable diseases also and non-communicable diseases. During COVID, we realized the importance of mental health, and somewhere the stigma or the issues that people were facing towards it has come down, but it still is a challenge. So I just want to give you a glimpse of what all we are working on. Even now, India has anemia. Sadly, we see that both adolescents and the adult age group people, not just women, even men have anemia, and it's a problem, that statement that even government is still working on. In India, we also have common cancers like oral, breast, cervical, and lung cancer. Oral, breast, and cervical cancer can be identified in the community. Lung cancer, though very common in India, we don't have any cancer detection community tools for it. So this is something that we are working on. And along with this, we are trying to see that we work more on the health and the preventive and the promotive aspects. Everybody goes to the hospital once he has disease. We want to see that we can bring down those chances for the people. So decentralized healthcare is what we are working on. And we are using opportunistic data capture also. Going to the population, getting the data, and identifying through routine interactions so that risk strategy can be put up. So let me just tell you a little about the AI-based health initiatives that we have. We have something called AI Nexus, which we are using in Bengaluru with Karnataka Health Promotion Trust, KHPT, an NGO, wherein opportunistic screening of 10,000 plus individuals is being done. I'll explain further about it later. For anemia eradication, we work with Mamta NGO in Lucknow, and we are using a technology called EasyRx, which is a non-invasive procedure. Again, I'll explain further that. With Adyar Cancer Institute, which is in Chennai, we are using Cure AI to see how best we can identify the lung cancers early. Along with this, we also work in Madurai with Vincent's, wherein we are trying to identify the individuals with NCD risk, stratify them, and provide them treatment early. So as I said, with KHPT, we have a smartphone as a diagnostic tool. The ASHA workers go to the community, they get the data of the patients. There is a technology called transdermal optical imaging, which uses face and finger to take the data. Some data is fed by the ASHA workers. It gets filled into the dashboard where the doctor can identify what is the risk for this particular individual, and they can decide whom to target first, who is a high-risk group, and who needs to come to the treatment early. So this is how we are doing it, and we have been able to do a pilot of it in around 3 lakh individuals. So this is how, using the AI, machine learning, we are able to put the data points there and do a risk stratification so that proper decision can be taken without burdening the doctor sitting in the nearest UPHC. So the doctor gets a triage, red, yellow, and green, and he can decide the action based on that. The red is the first group that will be targeted. Then with Mamta, we are using EasyRx, which is a anemia detection tool. The usual way is the painful needle-based technique that we were using all these years. This is a non-invasive technology developed by EasyRx, which is ICMR approved, and it's a spectroscopic analysis using machine learning. The data they have developed over a period of years, comparing the spectroscopic data with the gold standard data of blood testing for hemoglobin, and they have been able to help us identify the patients without any intervention. Okay, so spectroscopic data is taken, AI engine with the machine learning algorithm compares the wavelength against clinical data sets that it has and gives you the output. So this is a very low cost procedure, costing only 14 rupees per beneficiary. If you do the usual blood investigation, it will cost you almost 45 rupees, less than 1 minute of testing, not painful, and 95% accuracy as given by the ICMR. So in Lucknow, in our slums, we have covered almost 1,200 individuals. The ones identified here are then referred. The treatment is started for those who are in the low risk. Those with severe anemia are referred to confirm whether there is any other problem or reason behind this anemia, and treatment is started for that. Okay. This is another model that we are using with Cancer Institute Chennai. Cancer Institute Chennai is a very well-known organization down south, which is doing a lot of work providing treatment for the patients, cancer patients especially. So as I said earlier, lung cancer, though a problem, we don't have community-based screening things for it. So HCL Foundation is working towards identifying biomarkers to help in detecting lung cancer early. So when we are doing these biomarkers, we also ask these patients, okay, before I go to that, the inclusion criteria for us for this particular study research that we are doing is anybody above the age of 40 years, smoking history of more than 20 years, consumption of more than 10 cigarettes per day. So we identify these high-risk individuals who can potentially get lung cancer. We do the biomarker testing in them. Simultaneously, we also do the X-ray testing. Okay, and then we feed this data to the Cure AI to see if it is able to detect something that the doctor missed out. Okay, so the chest X-ray, CT are checked by a doctor also, a radiologist, and also by the AI. And then we compare to see how good is the comparison. Did it identify something new which we didn't identify? So this is one research work that is going on currently. And hopefully with this, we will try to identify some lung cancer biomarkers also. Okay. As I said earlier, in Madurai, we are covering the 31 UPHCs that are there in the Madurai Corporation area, and we work with WAP Trust, Vincent's there. It is a point of care, point of diagnostic device. Using that, we can again identify blood pressure, heart rate, SpO2, respiratory rate, skin temperature. To this, we also feed the weight, blood glucose, and the anthropometry data. So we get all these parameters fed into the system, identifying them again for the risk factors that they have, so that can again, this dashboard is put up for the government medical officer who can look at it. Risk stratification happens. Along with this, what we are also doing is anybody screened as diabetic or hypertensive, we confirm them in the lab of the hospital, in the PHCs, so that we know confirmed cases also. So this is going on currently for past 2 years. 4 lakh is the outreach. And using the ISH risk scoring, we have been able to give the risk stratification also for this. So these are some of the examples that I would like to put it across to you. So this is how AI has been used by us. But we do face certain challenges. When a father takes his daughter for EasyRx testing and they don't take a blood sample, he doesn't believe the report. So it becomes so much important for us to do a proper counseling for the father, making him understand that this is a very valid test that we are doing. This is helping us, and convince him to come for the next referral and to continue the treatment. So this human touch is still needed, though AI is making our work easier. Some of the black box trust gap issues are there, but which can be taken care of. We do our work, majority of our work through the NGOs. So convincing the NGOs to use such kind of technology also is a challenge for us at times. We have to create that idea, create that knowledge, information for them, and take it slowly. So most of our projects that you see are all pilot studies. Convincing the NGO and the population makes the things easier for us to take it at a higher scale. Though AI makes your technology investigation easy, it's equally important that you take some bit of time to convince, inform the people who are involved in the various stakeholders who are involved, so that it can give you the result that you are looking out for. Thank you. Thanks, Sam.
Thank you, ma'am, for your insightful and impactful address.
Our next speaker is Dr. Srijan Kishore sir, a sustainability and corporate responsibility professional at the intersection of CSR, ESG, ethics and social impact. He currently serves as a manager at Humana India, New Delhi, leading initiatives across education, health, community development and climate action.
Sir, we are delighted to have you here. We request you to kindly take the stage and share your perspectives with us.
I will try to conclude in 8 minutes. Okay, fine. I will start my timer as well so that I don't cross. Fine. We all know, looking at the topic, one may feel that, I am in a way trying to criticize the use of AI in CSR and ESG. That's not the case. The argument is very simple. The argument is whether AI is able to play the role of a facilitator in the entire decision-making process, yes or no. Okay, and that's the question that we'll be trying to answer in the next few slides. Fine. So how actually do we take the decisions? Primarily in today's context, we have two forms of leadership style. One is leadership by influence, another is leadership by authority. Okay. Many say that democratic style of leadership gives good results in the long term. Many say no. If you have to make a sort of reform in the organization, you have to take an authoritative decision, right? Now, as ESG professionals, it is very important that in the era of AI, we have this sort of skill to maintain the checks and balances, not solely driven by what the data suggests. That's important. But at the same time, as ESG professionals, it is vital important that we use our own judgment. And that is where, the role of understanding the expectations of stakeholders come into picture. We all know about the national guidelines on responsible business conduct. There are 9 principles issued by the Ministry of Corporate Affairs. If you look at the 4th principle, okay, it very clearly reads out that organizations today, companies primarily, they must respect all the interests of the stakeholders and at the same time, they have to be responsive to their demands, to their grievances, and other expectations. Because we know that, the market today has changed. Consider the example of Zomato. We all use Zomato, right? Zomato में अगर हम select नहीं कर रहे हैं that we need paper plates and spoons, तब तक नहीं आता है. Zomato is transitioning into green deliveries, isn't it? Are you all with me on this? Yes or no? Yeah. So in such a situation, the principle 4 of the NGRBC forms the nucleus of AI integration into CSR and ESG. And this is what we will have to understand. Okay, consider all other principles. The remaining 8 principles talks about responsibility, but principle 4 specifically focuses on how a company is responsive to the needs, aspirations, and grievances of its stakeholders. We all know that, India now has its own BRSR framework in addition to the other foreign frameworks like GRI, SBTI, SASP, and other. But the human element in the BRSR reporting is still very important. Look at the leadership indicators and the essential indicators. All those indicators under these 140 questions revolve around human welfare, employee welfare, stakeholder welfare, shareholder welfare. So these are some of the important developments that Indian CSR and ESG ecosystem is going through. We all know that the United Nations guiding principles focuses on 3 important parameters. The first is protect, respect, and remedy. Now, Professor Himadri is here. He must, I'm sure he will agree with me. Today, we are in the process of transitioning, okay? On one hand, we have ambitious target of becoming Atmanirbhar Bharat by, producing record coal. So we are, world leader in coal production, among the world leaders, and we are trying to become self-sustainable in a year or few. On the other hand, we have our commitments at the Paris Agreement and the Glasgow's Pact, where the Honorable Prime Minister has committed that, India will start moving towards our journey to net zero by 2070. Now, situations like this, further complicates the process. It's very similar. Those of you know a little about agriculture. If today you have to transition from chemical agriculture to organic agriculture, what you get is a U-shaped curve, okay? So initially the production will go down, okay, if you stop giving chemicals to the soil, and then eventually over a period of time it will grow up. Similarly is the case of just transition. Recently, a few years back, not recently, the National Green Tribunal, NGT, suggested the government of India that it must start decommissioning its coal energy plants. Okay, now what does that mean? If we start decommissioning our coal energy plants, simultaneously we will have to transition into renewable sources. We all know that for a country like India, it's very challenging to get smart technologies, and that too at a reasonable cost. Okay, because technology reaches to countries like India and other emerging nations a little late, and then they are very costly. Okay, so at the same time, how do we take that decision? Look at here the picture of it's created by AI, by the way. We have a board meeting going on. If the board only looks at the AI-driven data without analyzing the succession plan, without analyzing which leader or which employee has got what potential and where are we supposed to tap to raise the level of our employees, what kind of mergers and acquisitions are needed in the current market scenario, decisions may turn out wrong. So I always say there's a difference between building a business and building an organization. You can be smart enough, build a business, make it grow $1 billion company, but look at the cases of Paytm and Satyam, and there are many. Look at what happened to Blue Smart. So analyzing the stakeholders, understanding that ultimately they are our guide. Okay, they drive the organizations, they guide the decisions. If a board today stops analyzing the stakeholders, they stop analyzing the risk, they only focuses on AI, what will happen? You will see that there will be flaw in the proxy voting. Shareholders do not participate in the board meetings directly, but through proxy voting mechanism, they ensure that their voices are represented in the board meeting. And that is where companies need to understand that with AI, they also integrate their own judgment and their own understanding. So the 10 principles of the United Nations Global Compact, they form the nucleus of responsible business. I think there's some technical glitch, why I should have used my judgment and given a proper PPT rather than, a PDF. So this, but the slide wanted to say that, ESG indicators today are integrated in the business performance parameters. What does it mean? Suppose if I have to analyze a student, okay, what all parameters will I see? I will see whether a student is doing well in his or her academics, how is he or she in extracurricular activities. But one of the key indicator I will leave is whether a student is fit or not. Okay, that is also important, and that should have been given the equal weightage as academics. Similarly, if we talk about the 3 key performance parameters of a company, today ESG performance is by default one of the 3 or one of the top 5 parameters, and that is how investors judge or rate an organization and decide the investment. So as I mentioned, in GRBC Principle 4, it talks about being responsive. There are 2 important words. One is responsible, and another is that they have to be responsive. And that is where, it is crucial that we analyze the decisions and we analyze the data, because, more and more of the integration of data or AI is generative in nature. Okay, so it looks after the trend, what is first, but as a conscious leader, as an ethical leader, I also need to look after the other results. Okay, so I think the provost and the moderator will bless me for keeping exactly on time. I end my words here. We will take questions later. Thank you very much.
Thank you, sir, for your valuable and thought-provoking insights.
Dr. Neepa Saha Sharma ma'am, a senior CSR leader, currently serving as General Manager and Head CSR at CESC Limited, Kolkata. She leads the planning and execution of CSR initiatives focused on public health, education, sustainability, and community development.
Ma'am, we are honored by your presence. We request you to kindly take the stage and address the audience.
Good afternoon, everybody. Thank you, IIHMR, for having me here and giving me this opportunity to address the audience here. So, I think Tara has made my task easy because we are having a common topic. So he's spoken at length about the importance of measurement in ESG and CSR. So I'll briefly touch upon them, and I'll probably talk about some other things which is not part of my presentation. So as we all know, this is the biggest disruption now. It is kind of affecting all aspects of our life, AI, and so it was an equally important thing which is happening in the CSR and ESG domain. So as we all know that India is the first country which has made CSR mandatory for companies falling under certain criteria, and AI is absolutely, it is kind of governing the way we report CSR or ESG to our investors or to our stakeholders. So that has actually helped us in bringing in a lot of efficiency and a lot of transparency in the way we report our CSR or ESG metrics. So some of the key applications that AI has in CSR are, in determining CSR strategy. So AI can analyze a lot of data, identify priorities, and also map geographies and recommend solutions for arriving at a CSR strategy. So a lot of work can be handled by AI, and the most important application of AI, as you all know, is content creation. So we do a lot of content creation on CSR through AI. We do case studies, we analyze data, we generate CSR reports and summaries, and we also do a lot of social media posts using AI. AI helps us in learning, innovation, and scale, in the sense that, a lot of lessons that we have from the field can be captured using AI applications. It helps us in identifying scalable solutions, CSR solutions, and also identifying solutions which can be replicable. An important part of CSR is grant management. So AI can also play and plays an important role in screening proposals, in due diligence, verifying NGO credentials, and in generating MOUs and grant agreements, in ensuring that the MOUs and the proposals are in compliance with the CSR rules and regulations. As far as ESG is concerned, CSR AI plays an important part in the data aggregation. So a lot of the ESG metrics, the data is collated using AI. It helps in identifying various gaps and improvement opportunities across environmental, social, and governance dimensions. It helps in monitoring progress against SDGs and corporate and other targets which companies set for themselves, and of course in recommending operational changes that can reduce environmental footprint and improve business performance. So I think Tara has already spoken about this, how AI can impact the environmental, the social, and governance, the metrics. So I will not talk much about this. So we know that, in environment, how it can help us in reducing, monitoring, reducing carbon emissions, water and energy usage, and in predicting climate risk, in mapping vulnerable communities, in identifying areas where social interventions are required, and in governance, as far as governance is required, in monitoring whether the systems and processes at the corporate level are in compliance with the CSR law or the ESG practices. And of course, AI helps in a big way in generating dashboards, in integrating data, and in reporting and disclosure as per the BRSR reports, as per GRI standards and SASB and all the standards. So I would like to focus more on the challenges in AI implementation. AI is very good. It does hell lot of our work in very fast, which requires a lot of time, effort, human resource, is done in minutes. But what what actually is important to note here, that it lacks common sense reasoning. It's too high level reasoning, too logical reasoning. So the common sense human reasoning is missing somewhere. There's a lot of reliance on high quality data, and there's a high computation cost. Data privacy and security concerns are there, of course, because everything is, whatever we are uploading or asking through AI is up in the public domain. And there are also challenges of integrating AI processes, AI systems into existing processes. Data validation issues. There's difficulty in assessing qualitative information. Most of the information that is assessed using AI is in the, whatever is there in the, is written, recorded, or available on the net. So any information which is not available on the net is not assessed by AI, or not processed by AI rather. Data is not, it doesn't have a human, human angle to it. It doesn't go for field visit, it doesn't conduct third-party assessments or audits. And so it is whatever is being reported, only that information, that data is taken into consideration. Superficiality, because a lot of it is like very nice, polished reports, polished case studies, stories, but how much of it is actually grounded in reality, that is a question. There's a lot of greenwashing and a lot of impact washing happening through AI. And the last one would be accountability deficit. Whenever there is AI involved in decision making or in reporting, there is a clear lack of clear responsibility and ownership. So how do we make AI effective and relevant? It is important to localize and contextualize AI, localize to adapt it to local culture, local language, social norms, practices. We need to keep on, standardizing our key performance indicators, validate our data regularly, and do ground truthing to see that whatever is generated through AI is actually rooted in the ground reality. AI has to be embedded into the existing workflows. Whatever project cycle, whatever CSR project cycle, or whatever ESG processes are in place, AI should not be something external to it. It has to be built into the existing system. Then only the ownership will happen. Human in the loop. You have to combine AI insights with the human insights. There are people who are going to the field, meeting with the beneficiaries on a day-to-day basis. They have their insights, they have their experience. That has to be combined with the AI insights. Capacity building, of course, the people who are working in the area of CSR and ESG, their capacities need to be built on using AI tools, and also building digital literacy among the NGOs. So the NGOs who are there on the ground implementing the projects, their capacity have to be built to ensure that this actually percolates to the ground level. And last, to ensure trust and accountability. So we have to define ownership. As I said, that is one of the gaps, that AI lacks decision making, lacks accountability, and so we have to develop that. I would like to point out a few things that despite, this is all about how we measure, but what are we going to measure? We are going to measure, what we do is we work, the AI team or the report writing team works separately from the team that works on the ground. So the ground reality doesn't always get reflected in the reports. In fact, the reports look too good to be real. How much of it is actually grounded, that is the big thing. So AI is good for, we are using it in office for generating reports, for doing presentations. Even my presentation was done with AI. So that's one thing. But actually, are we looking at real world solutions? Problems, solutions to real world problems. That should be the role of CSR in integrating AI with real world problems, finding solutions, promoting inclusivity. Inclusive AI that our leaders have been talking about in the AI summit for the last 2-3 days. Against exclusivity. Accessibility is another thing which I would like to focus on, because a lot of us are doing AI and many of us are not doing it. So how do we make it accessible to everybody, especially our implementing partners, the NGOs? How whatever models that we are creating for, say, reducing energy usage, reducing water usage, reducing climate risk, there are certain models of excellence that are being implemented in pockets in various places. So how can we amalgamate the sporadic efforts or the scattered efforts that are being made into something which will have a wider ramification? That is something which needs to be looked into. And also diffusion. We need to diffuse the knowledge of just writing reports or just generating models, excellent models into various sectors in which we work as CSR professionals or as ESG professionals. We need to diffuse that knowledge into our agriculture sector or say health, education sector. HCL has been doing such wonderful work in diffusing AI into the healthcare sector. So ultimately that is the thing, unless we implement these things at the ground level, just writing and measuring doesn't make a difference. Things have to be reflected at the ground level. Thank you very much. Thanks.
Thank you, ma'am, for your enlightening address. The floor is now open for the Q&A session.
Kindly raise your hand and the mic will be brought to you. So I kindly request Dr. Gautam Sadhu sir for taking the charge for it.
Okay. I'm sure you are eager to ask question to the panel, and it is a gender balanced panel, you see. So we will able to take only 2 or 3 questions. Please excuse us, but please ask question if you have any question. Yeah, please. Give the mic to him. Tell your name.
Yes.
Stream and
Hello everyone, I'm Dr. Prasad Bogam. I'm representing Fortify Health, and my question is to Dr. Chetna ma'am. First of all, congratulations ma'am for really taking up so many AI tools to the community, and the way the work that has been done, it is really impressive. My question is about evaluation of these tools. Like, there are so many AI tools flooding the market. How do you evaluate these tools in terms of accuracy, in terms of there are different layers to that accuracy number that you shared, and also it requires a lot of AI knowledge to really evaluate those tools. So how did you go about deciding which tools to?
thank you. Give the mic.
Yeah, thanks for the question. See, I agree with you. There are a lot of AI technologies coming out in health domain right now. We are not taking up something which is new directly. As I said, EasyRx is something that ICMR has approved. We also see what kind of a background they come from, who are the NGOs that are using it, and then only take up, right? So that is how we are able to travel through this difficult task, I should say, I guess. Thank you.
Any other question, please raise your hand. Anyone? Okay.
Hello everyone, my name is Anushka Nanikwal, and my question is for Mr. Tara, sir. First of all, I really like that you mentioned that AI is not a solution but an amplifier. And my question to you is that you mentioned that we are facing an algorithm bias. So can you elaborate on what exactly are we facing in it?
Yeah, so see, the results generated by AI are based on certain data. If that data is biased, then the results would be, biased. So recently there was a news that, AI, when, it was allocating jobs, and the jobs, high stature jobs were allocated to, to surnames which belong to, upper caste communities. So that kind of data, AI doesn't have that, emotional or, human sentiments. So based on that, it was allocating. So sometime it may be, disastrous if we don't, verify the data or, if the data is, correct, or if the algorithm you have developed based on the data that includes those kind of, rationalities.
Thank you.
Thank you.
Any question to Dr. Nipa or Dr. Srijan? We can take two more.
Hello
Direct
everyone.
question, yeah.
Myself Raghavendra Singh Rajawat, and my question is for Dr. Srijan sir. My question is, in next 5 to 10 years, will AI become a necessity in CSR and ESG practices? And how should students interested in joining the workforce prepare for this transition?
See, rather the second part of the question should have been answered by some professor of yours. But let me give you my perspective. See, leadership and change management always comes in a phase-wise manner, okay? So, if today we are saying that 5 or 10 years down the line, what exactly will happen? So, simultaneously, we will also have to look at what is the trend, okay? Especially in case of CSR and ESG, we will have to understand one thing, that it is not only the CEO or the director who decides sitting at his or her own office, okay? Who is the ultimate target group to whom the the company is serving, okay? This also means that what are the expectations of my shareholders and stakeholders, okay? Now, answering to what specifically you have asked, how do you assess, okay? So in next 5 or 10 years, why, can you, I'm sorry, I missed the question. Can you just repeat the first part? Yeah, I can hear you. Just go. See, it has already become a necessity. Okay, most of the corporates today, when they go for due diligence, you just write this word due diligence, you can Google it and read it in detail. So most of the organizations, most of the companies who funds the NGOs or who suppose the trusts or foundations, so while they go for the due diligence in simple words is background check. Okay, so in order to ensure that there is no money making, no corruption, no bribery, no hawala, they have made it an important indicator whether the organization, they have integrated AI in their decision. Okay, so that's already happening. The question is whether it will grow in the days to come. Of course, yes. So we will catch up later again, and we can have a detail.
So I would request to answer this same question by Dr. Nipa in different angle. Yeah.
I think this question should have been directed to me because they are implementing agency and I'm a corporate. Anyways, thank you for the question. And AI, it is an icing on the cake. It cannot be the cake. You need domain specialists. So AI is relevant, will be more relevant. But if you don't have domain specialists, suppose tomorrow you say history, you will write history. I'm from history background, so I just said history. So if you write answers through AI, but if you don't know the history, if you don't know the principles, if you don't know the theories, then what sense will it make? So you have to go to the field, you need field people, you need MSWs, you need social scientists to do the groundwork. And they can be upskilled in AI to do the icing on the cake.
I'm sure there are a lot of questions, but we will not take any question more. But I promise that we will request them to take your session on the, module. Okay? Fine. Thank you.
Thank you everyone for insightful question and active participation. With that, we conclude the Q&A session and move forward with the next segment of our conference.
We have a small yet heartfelt gesture to express our gratitude to our speakers who have not only shared their knowledge but also empowered us with fresh perspectives and actionable ideas. It's now time to honor them for their contributions.
Now, we invite Dr. Gautam Sadhu sir to kindly step forward and felicitate our esteemed speaker. Mr. Tara Chand, sir. Dr. Chetna Tirathali, ma'am. Dr. Srijan Kishore, sir. Dr. Neepa Saha Sharma, ma'am. With this, we now invite Dr. Ratna Verma, ma'am, to propose vote of thanks.
Good afternoon, everyone. Good afternoon. Yes. It's my privilege to offer a formal vote of thanks to our esteemed guest speaker for track 2. So on behalf of IIHMR, I would like to extend a heartfelt gratitude to Mr. Tara Chand, Dr. Chetna, Dr. Srijan Kishore, Dr. Neepa Saha ma'am, for a very enlightening and very insightful sessions. So what I would like to say here as a formal vote of thanks, your session were really, really very insightful, and I would say the sessions were really grounded. So in all these sessions, the common point which we have learned is that AI, of course, is very, very important, but there are certain points, there are certain things which we need to keep in mind, and the important point here is the grounded reality which need to be kept in mind. The human expectations, the human experience are very, very important to be taken care of. So your expertise has, I'm sure, have added a special value to the knowledge of our audience today. Thank you so much for joining the sessions. So I once again extend my gratitude to all the guest speakers for making this session a great success. I'm very thankful to the moderator, Professor Gautam Sadhu sir, for steering such engaging discussions today. All the students who have actively participated post-lunch to the session, and all the faculty members who have actively participated and joined the track 2 session. Thank you so much on behalf of IIHMR. Thank you so much all.
Thank you, ma'am. With that, we now wrap up track 2 of GHMRC 2026. I request everyone to kindly be seated for the MOU signing ceremony. I invite Pallavi and Christina for the next session.
हेलो 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 चेक हेलो एक मिनट हेलो 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 हेलो
हेलो हेलो हेलो अब आ रही है।
At Pradanya GHMRC 2026, we did not merely exchange ideas, we envisioned a future shaped by collaboration, purpose, and innovation. Because real transformation does not happen in isolation, it begins when institutions unite with a shared commitment to progress.
This session celebrates the power of partnerships where visions turns into action and collaboration becomes the cornerstone of sustainable impact. We now proudly commence the partnership and MOU signing session, a landmark moment that reflects our collective promise to advance academic excellence, research, and social development.
To begin this session, we request the presence of esteemed dignitaries on stage, respected Dr. P.R. Sudani Sir, President, IIHMR University, Dr. Mamta Chauhan Ma'am, Professor, IIHMR University, Ms. Kirti Agrawal Ma'am, Manager, Partnership and Strategy, IIHMR University. We request you all to kindly come forward and take your places. To formally open this session, we are honored to invite Dr. Mamta Chauhan Ma'am, Professor, IIHMR University, Jaipur, to extend the welcome address.
So good afternoon to all distinguished dignitaries, esteemed industry partners, development partners, colleagues, and dear participants. With proud privilege and joy, I welcome you to this special session of the Global Health Management Research Conference 2026, the MOU signing ceremony. Today, it's not just a ceremonial moment, it's a defining milestone for us. We at IIHMR University always believe that conferences should not end with discussions alone. They must lead to collaborations, commitment, and concrete actions. I'm delighted to share that during these sessions, we will be signing around 8 MOU with esteemed institutions and industry partners who share our commitment to strengthening global health systems. So these MOU represent 8 shared visions, 8 commitment to collaborative research, 8 pathways for capacity building and knowledge exchanges, and countless opportunities for innovations and impact. In today's complex global health landscape, where we face workforce shortages, implementation gap, health inequities, climate-linked health risk, and behavioral challenges, partnerships are not optional, they are essential. No single institution can solve these challenges alone. It is through strategic alliances across academia, government, development partners, implementation agencies that we can generate evidences, translate research into practice, and influence policy at scale. These collaborations will strengthen our collective effort in health system research and governance, public health leadership and workforce development, behavioral insights and implementation science, policy translation and evidence-based decision-making, innovations in health management. For us, this movement reflects institutional maturity and trust. It signals our partners recognize the value of long-term collaboration, shared learning, and joint action. On behalf of the IIHMR University and our organizing committee of GHMRC, I extend my sincere gratitude to all partner organizations, namely Bombay Hospital, Population Council Consulting Limited, Fortify Health, C-High, Ambuja Foundation, Parivartan Skill Academy, Essence Super Specialty Hospital, Foundation for Ecological Security, ITEC, Ministry of External Affairs, Government of India, who are joining hands with us today. We deeply value your trust and look forward to a productive and impactful association. Let this ceremony mark the beginning of enduring partnership that go beyond documentation and translate into measurable improvement in health outcomes, system efficiency, and community well-being. With these words, I warmly welcome you all to this important session and look forward to the formal signing of these MOUs. Thank you so much.
Thank you, ma'am, for your warm words and inspiring perspective.
To share the vision behind the collaboration, we now invite respected Dr. P.R. Sudani Sir, President, IIHMR University, to reflect on the theme, Building Partnership and Collaboration.
Well, good afternoon. So we started this annual conference in the morning, and after the 2 sessions, now we have a very important and exciting session on building partnership and collaborations. As we all know that the partnership or collaborations are very, very important for the healthcare sector, and what we want to achieve in the health system, one organizations individually cannot achieve the health policy goals, and therefore the partnership is in central. Everyone has to contribute towards achieving the national priorities, global goals, and therefore as an IIHMR University, which is one of the premier institutions in the health management research, we decided that in our strategic framework, one of the strategic pillars is enhancing the strategic partnership and collaborations among the organizations. We conduct this annual workshop, but from the last year only, we decided that to give more focus on the partnership and collaboration activities, we have scheduled one session during the conference itself. And this is the second year of such initiative. Last year also we signed various stakeholders, and all these stakeholders are with a major objective that they are advancing the global health management practices in different ways. Since IIHMR as a university, our objective is also to advance the global health management practices, knowledge, and many more activities related to that. And therefore, we are always pro to the partnership or collaborations with national or international organizations. It may be an academic institution, it may be research institution, governmental organizations, private sector, not-for-profit sector, or development partners. Thanks to all the organizations which have decided to come forward and to sign with IIHMR University for advancing this objective. Today I am also very happy to share that during this financial year, we have been identified as a partner institute for capacity building by the Ministry of Health, Ministry of External Affairs, Government of India. And as a partnership model, the Government of India's Ministry of External Affairs, they asked IIHMR University to design, conceptualize a 2-week training program for international participants. I'm happy that all the international participants under that program, they are also here. That makes a very, very, fruitful that our partnership is working, even with the Ministry of External Affairs. And it happened so fast that after approval of our proposal, they immediately nominated, the nominations we received from 13 countries all over the world. Thanks to you for being with us during this ceremony. And that's that testimony that the IIHMR University is always working at the global level with different geographies. You were here in the campus since last 2-3 days, and I have seen that you are so serious in your training and also enjoying the training and beyond the training. So a lot of discussions, dialogue, deliberations are among the participants. We can proceed with this, that we can do much more activities among your countries, the country from where you are coming. And IIHMR faculty teams, IIHMR staff, they are always with you to support you in one way or other way. Either it can be the research, training, capacity building, in whatever format you want our help, our support, we are always here. And please try to contact IIHMR for any such support. Thanks for your coming here and joining the conference session and also be part of with this session. Thank you so much. I am also extremely thankful to your countries that they decided to send you in IIHMR. 2 weeks is very important for the person like you, those who are already, at a very responsible position in your ministry and means away from office for 2 weeks. It really cost too much to the government, but the government decided to send you, nominate you, and they are also expecting you that you will come up with new knowledge, new training and all these things. So that is one way of, partnership results very well. And we are hoping that such partnership models will work with various other countries also and with many more organizations, those who are coming with us on this occasion. Once again, I thanks all the student community, faculty, delegates, those who are here and attending this particular session also. Every year we are trying that we can improvise on our partnership model and also we can learn from other organizations. There are a lot of learning, mutual learning when we work together. We also learn from you. You can also learn something from us and we can mutually work together to improve the health system's performance. So once again, thank you so much and have the session, please.
Thank you, sir, for your visionary leadership and motivating words.
We now arrive at the most significant moment of this session, the MOU signing ceremony, where collaboration transforms into commitment.
Each partnership we celebrate today strengthens the bridge between academics, healthcare, and community development.
To begin this partnership journey, we are honored to welcome our partner who represents excellence in patient care and clinical leadership, Bombay Hospital Trust. Bombay Hospital Trust is a leading healthcare institution known for excellence.
We request Dr. Vijay Shah, sir, Head of Medical Services, Bombay Hospital Trust, to formalize this shared vision through the MOU signing. Sir, we would be grateful if you could share your thoughts with us.
Hi, good afternoon all. This is Dr. Vrajesh from Bombay Hospital. So Bombay Hospital has its legacy since last 75 years. It has started its first branch in Mumbai in 1946, and since last it's growing. We have total 3 branches currently in Mumbai, in Indore, and in Jaipur current. So, and upcoming branch in Ranchi also. So there are all the hospitals having more than 500 bed capacity and state-of-the-art facility. So I am being an alumni of this alma mater and head of the unit of the Bombay Hospital Jaipur. I am really grateful to the Sudani sir that they have given this opportunity to have collaboration with Bombay Hospital and IIHMR. So it is also good for these students to have their trainings, dissertation and placement even. Thank you so much, sir. Thank you.
Thank you so much, sir.
We now welcome a globally respected organization advancing health and equity through research and innovation. Population Council. Population Council is a globally respected research organization working to improve health, equity, and well-being.
We now invite Mr. K.J. Venkateshwaran, sir, Chief Growth and Operations Officer, Asia of Population Council, to mark this moment of partnership by signing the MOU. Sir, we would be delighted if you could share a few words with us.
Good evening, everyone, and thank you for joining hands with Population Council. I represent the Social Impact Advisory arm of Population Council. We are 75 plus years old, much like the Bombay Hospital Trust, but we've been a global organization advancing population and development related work. Globally, any work that's done on population and family health, Population Council's name gets associated with it. We've been kind of working that long and into those areas. And we've been looking for partners. We do look for partners who have the same passion as we have for research, for development, for advancing health, and we are glad to join hands with IIHMR to advance that journey. We look forward to stronger collaboration between the two institutions. Thank you.
Thank you, sir.
Our next partners are the organization that creates a lasting impact on public health. Fortify Health. Fortify Health is a global, non-profit organization dedicated to reducing micronutrient deficiencies through food fortification and nutrition programs.
We now invite representatives of Fortify Health, Dr. Prasad Bogam, sir, Senior Director, Research, Mr. Daneshwar Vankade, sir, Senior Partnership Officer, to formalize this partnership by signing the MOU. Sir, if you would like to share a few words, we would be honored to hear from you.
Thank you. I'm Dr. Prasad and I'm representing Fortify Health, and thanks for the introduction. Very quickly, as the anchors mentioned, Fortify Health is working to reduce iron deficiency anemia in the country. We have already seen since morning anemia is a big problem. And we work with wheat flour millers in the country in private sector and also with the state governments to fortify wheat flour to reduce iron deficiency anemia. And since IIHMR has a very, very long history of working in fortification space, this is really our privilege to partner with IIHMR University. And through these partnerships, we really hope that we take the research forward, strengthen our program evaluations, build evidence to inform the policies, and eventually strengthen public health. And especially it is very moment of deep personal significance, sir, because almost more than a decade ago, I stood here as a student of first batch of MPH program with Johns Hopkins University. And coming back again here as a partner, but also a student, sir, is really a very great moment for me. And also, I hope it inspires students also to one day, once you start journey from here, come back again after some time, one day, not just as a student, but also to contribute, opportunity to contribute to the university. So this is really a proud moment for me. And also I think this partnership will also open doors for students to learn from the real world setting in fortification space and nutrition space. Thank you, sir.
Thank you, sir. We now welcome the Social Innovation in Health Initiative, a global collaborative platform that supports and promotes innovative health solutions to improve healthcare access and delivery.
We are pleased to have the representatives join us in the online mode for this MOU signing. Dr. Mihut Mihai from TDR, Dr. Meredith Del Pilar, MD, Professor, Department of Medicine, Coordinator and Chairperson, Research Unit, School of Health Sciences, Lead for CHI Unit, University of Philippines, and Mr. Joseph Tucker, Professor and Director of UNC, Project China at University of North Carolina at Chapel Hill.
Very brief, and just to say that we as TDR, together with our co-sponsors, UNICEF, UNDP, the World Bank, and the WHO, are continuing to support this initiative, which we see as very important. The role of social innovation in health is quite unique to enhance access to health care and to health coverage, to universal health coverage, and therefore a bigger impact on population health. We all know that the top-down approaches do not always work. We all know of the energy that lies in innovation from communities, and we would like to foster that and to facilitate it. Make sure that social innovations that improve the lives of the most marginalized communities are taken up, are scaled up, are being replicated for further impact. Thank you very much, and
Recording in
we
progress.
will be behind you in this endeavor.
Good afternoon, everyone, and thank you, Michael. And I'm Dr. Meredith Del Pilar Labarda, the lead for the Social Innovation in Health Initiative Global Network Secretariat. I am based at the University of the Philippines. And just a brief background of CHI Global Network. We are a vibrant global network dedicated, as Michael mentioned, in accelerating universal healthcare coverage through social innovations, community engagement, and social justice, especially in low and middle income countries. And since our inception in 2014, the network has continuously expanded, bringing together a vast diverse group of passionate individuals, organizations, and institutions who share a common goal. So on behalf of the Social Innovation in Health Initiative Global Network, we are pleased to formally join this partnership with IIHMR University and officially welcome them as CHI Hub. So we look forward to working closely with your team and your university as part of the CHI Global Network. Please accept our congratulations on this milestone and our appreciation for your commitment to this shared mission. Good day, everyone.
Hi, I'm Joe Tucker. I'm an infectious disease physician at the University of North Carolina at Chapel Hill. Delighted to be with you and really honored. I think IIHMR has a long tradition of innovation, and for some of you, you may not have heard of social innovation before. This is when you're affecting change not only with health outcomes, but also with social outcomes. And there's so many innovations that are really exciting, not just in Jaipur, but more broadly in India and in the region. And I'm really excited to learn more about what innovations, social innovations specifically, you're working on, and to partner more closely with you in the coming years. So congratulations to the whole group, and really look forward to working with you in the future. Over.
Thank you so much, sir and ma'am.
We would also like to acknowledge our valued partners, Strategic Alliance Management Services Private Limited and SAM Social Talent Connect Private Limited organizations committed to strengthening human resources and capacity building initiatives.
Though they are not physically present with us today, we are pleased to acknowledge that they are part of this collaboration and will be formally signing the MOU. We look forward to a meaningful and impactful partnership with both the organizations.
Our next partner is empowering youth and strengthening communities through skill and opportunity. Ambuja Foundation's Parivartan Skill Academy. Ambuja Foundation, through its Parivartan Skill Academy, empowers youth with employable skills and supports sustainable livelihoods across communities.
We now request Ms. Pratibha Sudhani ma'am to come to the stage and take this collaboration forward by signing the MOU. We would be honored if you'd share a few words with us.
Thank you so much for giving this opportunity, signing this MOU with the prestigious University of Jaipur, IIHMR University. So we are from Ambuja Foundation. Ambuja Foundation is a very dedicated organization who work for the welfare of the society. We are thematically CSR working projects, and especially in water, agriculture, skills, and other livelihood projects. So Parivartan Skill Academy is a CSR initiative of Ambuja Foundation and HDFC Bank, who are collectively working for the welfare of the youth. We train them in various sectors, especially in health, banking and finance, and IT sectors. So further, this partnership will definitely going to help us to strengthen our mission to train and thrive and transform the lives of youth, especially India. Thank you so much.
Thank you, ma'am.
We now invite a hospital committed to quality, compassion, and advanced healthcare. Essence Super Speciality Hospital, which is recognized for high-quality medical care, advanced infrastructure, and a strong commitment to community health.
We request Mr. Ajay Bhati Sir, Head PCS, to formalize the shared vision through the MOU signing. Sir, if you would like to share a few words. Thank you, sir.
Our final partner is dedicated to empowering communities and sustaining natural resources. Foundation for Ecological Security.
We now invite Ms. Alka Tirke ma'am, Ms. Poonam Kulshrestha ma'am, Ms. Dimple Kumari ma'am to come to the stage and seal this collaboration.
Ma'am, we would be honored if you would like to address the audience.
Yeah, hello. It's a place where I'm seeing that we would be like, it seems to be out of place talking about ecological health, but I like to say that I would like to connect with all of you, like if the basics of any health would be like keeping up with the ecological health, that would lead to the human health. That's what FES Foundation for Ecological Security works on, engaging with communities and working with or managing sustainably the common natural resources of our earth, of our villages and rural areas, So this internship would, this MOU would help in taking up jointly the students' internships and jointly taking up research or where we can connect how the natural resources are important basis for the health of our human beings. So thank you for this. Thank you.
Thank you, ma'am.
As part of the International Training Program on Transformational Leadership for Health System Strengthening, organized by IIHMR University under the Indian Technical and Economic Cooperation Program of the Ministry of External Affairs today, we are privileged to hear from a distinguished international delegate.
To begin, I would like to invite Dr. Yusuf Shikku Tejin, Medical Superintendent, Ministry of Health, Sierra Leone. Sir, kindly come forward and share your valuable insights with us.
Good evening, everyone. It's quite cold in here. So I'm Dr. Yusuf Shikku Tejin, a medical superintendent from Bo Regional Hospital, the second largest hospital in Sierra Leone. I really want to take this opportunity to thank the Indian Technical and Economic Corporation and Ministry of External Affairs and IIHMR, Prof, and the team for the warm invite and the exciting moment we've had so far in India. This is my first time in India. I'll tell you the essence of collaboration and partnership. 20 years ago, Sierra Leone had one of the highest maternal mortality ratio in the world, over 1,650 per 100,000 live births. After a devastating civil war, 10 years, Ebola outbreaks, and other infectious disease, we are lost. But due to effective collaboration and partnership, we are able to partner with West African countries, Asian countries, and other NGOs, UNFPA, WHO, and UNICEF. Currently, I'll tell you, the milestone we've covered for the past 2 years is unremarkable. We've had one of the steepest drop in maternal mortality in the whole African sub-region, 70%. That was due to collaboration. I also want to affirm that Sierra Leone has now recognized partnership and collaboration as one of the most important tools. In our current policy, which is towards universal health coverage, and we are using the life stages approach, my few days in India, what I've learned from the health system lectures and other different sessions, it means that we are on the right track. Partnership, as I say, and collaboration goes beyond signing. It is a learning opportunity. It's for you to see how you could best improve your health system. It's for you to see how you could identify some implementation challenges in your institutions, in your organizations, and even in your country. So on that note, I want to thank the Ministry of Health, Sierra Leone, the government of India, the IIHMR for this exciting opportunity to come and learn and also grow. And together, I believe we'll have a very excellent collaboration when I return back in Sierra Leone. Thank you very much.
Thank you so much, sir, for your thoughtful reflections.
Next, it is my honor to invite Dr. Ruqayya Ethajman, Laboratory Scientist, National Institute of Hygiene, Ministry of Health, Morocco.
Assalamu alaikum, namaste sabheko, and hello everyone. So my name is Ruqayya Ethajman, and I'm from the Kingdom of Morocco. I am a doctor in microbiology and molecular biology, and currently working at the National Institute of Health under the Ministry of Health in Morocco. And I'm also working at the National Poliomyelitis Laboratory, where I contribute to surveillance disease and laboratory diagnostic. I'm also a national coordinator of the containment of poliovirus, where I contribute to the national effort to maintain the polio-free in our country. So being part of this critical public health mission has strengthened my commitment to protecting communities and also supporting resilient health system. I would like to sincerely thank the organizer of the program, this program, and also I would like to thank the institute, the Indian Institute of Health Management Research, for this valuable opportunity. So this program not only will strengthen our professional capacities and knowledge exchange, but also will reinforce the collaboration between countries, as it is the case for my country. Actually, Morocco and India, two countries with a rich history and ancient civilizations and a deep cultural heritage, share a strong value of resilience and diversity and commitment to development makes this partnership even more meaningful. And through this experience and during these 5 days, I have gained new insights into strategic partnership and also leadership and cross-sector collaboration and sustainable health system strengthening. And I truly believe that the partnership built here, it continue beyond this program and contribute to strong, more resilient health system. Again, thanks to the organizer and all the staff who has welcomed us with warmth, and to everyone who made this experience possible. Dhanyavada.
Thank you, ma'am, for your enlightening address.
Now, may I request Dr. Mutis Bila Oslati, Director of Jendoba Nursing School, Tunisian Ministry of Health, Tunisia, to kindly address the gathering.
Hello everybody, Namaskar, Aslama. Ladies and gentlemen, it's with great joy and gratitude that I'm here today as a participant within the Indian Technical and Economic Cooperation ITEC program, a platform that facilitates knowledge sharing and international collaboration held by the Ministry of External Affairs of the Government of India. I'm truly honored to be part of this transformative journey alongside such talented group gathered from different nations, 13 nations? 13 nations, yes, to learn and evolve together in a field as vital as health. First and foremost, I would like to express my heartfelt thanks to the Indian Institute of Health Management Research University and its partners for this steadfast commitment to advancing education and leadership in the healthcare sector. The international training program in transformational leadership in health system strengthening offered by IIHMR University is a unique opportunity to develop essential strategic and leadership skills while fostering vital global partnership that are crucial to addressing the ever-evolving challenges of the health sector. At the heart of this partnership is the idea of transformation, transforming our approach to health management, transforming how we think about leadership, and transforming how we collaborate together. A transformational leader, whether in health or any other field, does not simply manage processes or lead terms. They inspire, enhance, and guide others to push their limits. Shared vision of leadership in health, a leadership capable of transcending cultural, economic, and political boundaries to achieve tangible goals. Today, as we gather in this beautiful city of Jaipur, the Pink City, I invite each of us to reflect on what we can offer and what we can learn from others. It's through this mutual exchange that the key of our collective success lies, whether in the context of training programs or future collaboration. It is by uniting our strengths and respecting our difference that we will be able to create innovative solutions tailored to global health sector. As a participant from Tunisia, I deeply appreciate the importance of international cooperation, especially in health, a field that impacts every individual regardless of his or her nationality or background. The collaboration between Tunisia and India brought together by this program is a prime example of how nations can together strengthen their healthcare system and foster innovation and also create lasting impact on the global health landscape. By working together, we have the opportunity to ensure that healthcare policies and practice evolve to better meet the needs of our communities. We can focus on incorporating technology, innovation, and patient-centered approach to ensure that the health system are both sustainable and effective. This is the power of partnership, and this is transforming healthcare on a global scale. In conclusion, I'm confident that through the power of collaboration and shared knowledge and learning, we can create a future where access to quality healthcare is a universal right, not a privilege. I'm deeply excited to continue this journey and look forward to positive outcomes that will arise from our combined efforts. Thank you for your attention, and I wish you a great success in your project and dreams, and together we are stronger. And before finishing, I would like to highlight an interesting testimony. Within just 2 days, we experienced something truly remarkable. We celebrated together the Lunar New Year of Mongolia. And yesterday, we marked the beginning of the holy month of Ramadan. Different traditions, different culture, different spiritual meanings, yet all brought together in the same place at the same university. This is more than coincidence. This is a living example of tolerance. This is a lesson of respect. This is peace in action. Our differences become bridges, not barriers. And in sharing each other's celebrations, we discover that humanity is stronger than identity, and unity is stronger than difference. Today, university is not only an academic place or academic institution, but also a gathering of culture, a meeting point of hearts, and a symbol of harmony. Thank you for all of you. Thank you for this beautiful moment. And thank you for India, the land of peace and tolerance. Thank you.
Thank you, sir, for your inspiring words.
Finally, I would like to invite Dr. Orzoi Said, Director, Center for Prevention and Combating HIV in Rudaki, Tajikistan.
Hello everyone, good afternoon. I am Dr. Orzoi Said. I represent Tajikistan. First, I want to say thank you very much to Dr. Saloni. He's very nice. He taught us very important things. I am a Director Center HIV in Rudaki City, also assistant of the Medical University. I have been working as director since 2019. I am deeply honored to participate in the transformational leadership for health system strengthening under the ITEC program. It's very important for me. Actually, I am going to be head of big hospital. It's a good opportunity. Now I would like to speak about the ITEC program. The ITEC gives the professionals from 13 countries the chance to learn, share experience, and improve their skills. This program is not only about studying, it's about building leadership and friendship between countries. Through ITEC, we learn from Indian experts, from our teachers and each others. We understand different health systems and new ways to solve problems. When I return to my home, not only with new information, but with new ideas, new motivation to serve my people better. Bart और राजस्थान की संस्कृति परंपरा और लोगों का प्यार अद्भुत है। यह आकर मुझे घर जैसा महसूस हुआ। धन्यवाद। भारत माता की Thank you very much.
Thank you very much, sir, for your impactful address.
Before we depart, CHI India Hub have developed a web page. I request IT to please show this web page, which is a testament of our partnership together.
Thank you. These partnerships stand as a promise of shared growth, innovation, and social impact.
Let us give a warm round of applause to all our partners for joining hands with us.
To formally conclude this session, we invite Ms. Kirti Agrawal Ma'am, Manager, Strategy and Partnership, IIHMR University, to propose the vote of thanks.
So, good evening to one and all present here. On behalf of the organizing committee, I would like to extend my sincere gratitude to all the institutions who participated in today's session on building partnerships and collaboration. The session on building partnership and collaboration has highlighted a remarkable opportunity for all of us to come together. The synergetic effect would not only strengthen our respective organizations, but most importantly, provide transformative learning experiences to all of us with a global perspective in a collaborative way. I would also like to take a moment to express our deep appreciation to the leadership and the administrative teams whose vision and tireless support have made this platform a reality. Their dedication to fostering an environment of cooperation is the foundation upon which these future collaborations will be built. By working together, we are now better positioned to advance the agenda of global health management to the next level. I would also like to offer a special thanks to all my colleagues from iTech training program for their invaluable insights and experiences today. Once again, thank you all for presence and for joining us on this important session. Thank you so much, everyone.
Thank you, ma'am, for those kind words.
Ladies and gentlemen, as we conclude this formal session, we now invite you all to join us for the gala dinner beginning at 7:30 p.m.
Okay. Where we continue the celebration in a more relaxed and joyful setting. Enjoy this evening and have a wonderful time.
Thank you.
Also, I'd like to invite all the iTech partners over to the stage for a group photograph.
I invite you all to join us for the high tea.
I request all the faculty members to please come on stage for the group photograph. I request all the faculty members to please come on the stage for group photograph.
ठीक है नहीं